Caregivers have to realize that they are the quarterback of this team. They're not the line staff. You're not the period at the end of the sentence. You have to make things happen. You don't have to do it all yourself. And that's hard because we feel like we're abandoning or being selfish, but self-care is not selfish. You have to get a team around you of people who are going to help and to use your leadership skills. I have an executive in insurance that I work with, and she works 14-hour days, and on her way home, she goes to the grocery store and she comes home and she makes dinner and she does laundry and she takes care of her mom. And after her mom goes to bed, she stays up all night doing paperwork and starts the next thing again the next day. And when I was talking to her about it, I said, "Do you make the coffee in your office?" And she said, "No." I said, "Get those groceries delivered. Hire a teenager to come do your laundry." I mean, those management skills that she uses in her business. She has to understand that she's also CEO of the caregiving system. And that's what allows you to make that fifth key work for you. You take care of yourself. And part of it is delegating. I think that the social determinants of health that affect vascular disease in our community, that increases our risk of diabetes and heart disease and strokes and dementia, are very major. Plus, the racism that we find and the ageism we find even in the professional community makes it difficult to be a caregiver, because you have to fight not just your own emotions for watching this person you love change. You have to keep on top of all of their issues, their medications, their appointments, but you also have to fight with the professional caregivers. For example, I went home for a wedding. I was going to take my aunt to the rehearsal dinner, and I walked into her house and she was unconscious. And Dr. Woodson showed up and did what she was supposed to do. I took her to the hospital. I worked with the ER people. I stayed with her for 2 days, and her doc walks in the next day. And this is the practice that has been taking care of her all these years. And I said, "I want to get her up today." And he goes, "Well, you know, she's 97 years old. She was 97 last week too." You really have to fight so many different things. Also, while I was staying with her, I found that everybody came in, they just started doing things to her. And it's like, no. You have to tell her before you draw blood. You have to tell her before you move her. She's not some little physiologic box that you're working on that has no feelings. So you're fighting that as a caregiver. And it's so much to do while you're also grieving the loss of this person. So we're fighting ageism, racism, sexism, as well as this elitism that the profession can have, forgetting that they're taking care of people. And caregivers have to manage all of that. The medical profession, the way we're trained, teaches us something that is not true. It makes us expect to cure people. We've never cured anybody. Our job is to use the science as we understand it to give people the best shot at the quality of life they want. And that means respecting them as people. So that's one thing in terms of the training that I do for professionals. What I do in the community to work with disparities is to help us understand that we are the cavalry we're waiting for. Yes, there are food deserts, and so healthy eating is not possible. Yes, it's dangerous in our community, so you're not going to be walking your mile around the community. But the community has the resources. While we're waiting for the public policy and the government to catch up, we can do this. There is a church on the south side of Chicago called Trinity United Church of Christ. From May to September every single year, they have a farmer's market in their parking lot. They call it by any greens necessary. So fresh produce is brought into the community. Now, if we want to help people exercise, nobody has a car to drive to the mall to walk around, but you can walk around the church between 10 and 2. I mean, we can provide a safe place for people to exercise. And in a church that has at least 1,000 people, if the pastor says, "Are there any certified personal trainers here?" There's going to be at least one. They can put together training programs Thursday night after choir rehearsal, Saturday morning before the Cub Scouts meet. I mean, we can do a lot of this ourselves.